right, this meeting is called to order at 11:01. Roll call, please.
Howell is not here yet. Kokendorfer is absent with notice. Gershenson.
Here.
Nelson.
Here.
Taub.
Here.
Loops.
Here.
We have one.
Please rise for the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Are there any corrections to the previous minutes of July 8th? If not, we need a motion to approve the minutes. A motion by Commissioner Nelson, second by Commissioner Gershenson. Any discussion? All in favor say aye.
Aye.
Opposed? The motion is carried. The next item is approval of the agenda. Are there any changes or corrections to the agenda? Seeing none, we need a motion to approve the agenda. Motion by Commissioner Gershenson, seconded by Commissioner Taub. All in favor signify by saying aye. Aye. Opposed? The motion is carried. The next item is public comment. If there's anyone from the public wishing to speak, and now is the time. Public comment is closed. We move on to our next item, which is communications. The fiscal year 2019 to 2021 contingency report. It's a report we will receive and file. Any comments or questions on this report? Then a voice vote. And I need a motion to receive and file. Motion by Commissioner Nelson, seconded by Commissioner Gershenson. All in favor signify by saying aye.
Aye.
Opposed? The motion is carried. We move on to our regular agenda. First item is Health and Human Services Health Division, 2019 Beach Recommend Monitoring Program Grant Contract with the Department of Board of Environment, Great Lakes and Energy, project number 2019-7210. Do we have a motion? Motion by Commissioner Taub, seconded by Commissioner Nelson. All in favor? Oh, yes, we need that. Thank you. Welcome.
Good morning. Good morning. This grant is actually a continuation beach grant that we received from DEQ prior to this year and Eagle now. It is a reimbursement grant of $89,233.33. It goes from the April 2019 to December of 2020, so it is a 2-year grant. And they do require a local match for this. So the majority of this is used for salaries for our students that come in and do our sampling. In 2019, we are sampling 75 beaches. And that allows us to not only do our what maybe you call our standard sampling, but also our qPCR, which is sort of that source tracking that can kind of tell us what type of waste it is or E. coli it is. So in the past, we may have done more beaches each summer, but because we have the qPCR testing, it requires additional sampling, which takes a little more time, and so that's why we are doing 75 this year.
Thank you. And any other comments or questions? Commissioner Taub?
Yes. How many beaches do we inspect all together? And is it a 5-year period?
So we used to cycle through our beaches every 5 years. You are assured of having testing at that beach. Because of this qPCR mode that we're in right now, where we're doing testing for 3 to 4 years, and there's a tremendous amount of extra volume of work, and the number of beaches we're testing has gone down. It's more than that, but next year we're going to get back on track, so we're back in that 5-year cycle. There's 249 active beaches, every year, some beaches will come online or go offline for a lot of different reasons. Some beaches are not well maintained, of those 249 beaches, 47 are only truly public beaches, only 47. The rest are semi-private or semi-public. They're sort of referred to one way or the other. There's 202 of those. And those are and you should know that we do test all 47 truly public beaches every year. They never fall out of the cycle.
Okay.
And we cycle through the others.
So, let me just ask you this. A lot of our communities have organizations, either beach or lake
Right.
organizations, or we have lake boards, you
Yeah.
know, whatever. Has there been any thought of having you test ones and have the lakes pay for the testing annually?
Well, I don't know that we've exactly thought of that, but what we have done is ones that have homeowner associations, and if we're not gonna be visiting them, we let them know. We'd be happy to train them if they wanna have folks regularly and routinely test them. We will help them, we'll provide technical support, and we will also, test those bottles for free so that there's no charge for that. And we'll analyze it and make recommendations based on that. But they have to agree to the fact that if they have, there's two different ways to look at beach testing. They have a daily geometric mean if they exceed that, or if they exceed a 30-day geometric mean. We would have to declare that beach closed. So,
Okay.
and they have to agree to that because we can't analyze a semi-public beach and let them know that, the water quality is poor and then not follow through with a closure.
Okay.
And I think there might be some that are absolutely taking us up on that.
Great, that's wonderful. So, everything is free, you do the work.
Exactly,
Okay,
yep,
that sounds fair.
yeah.
I feel badly about places that want it tested every year and they don't do anything themselves, they just
Yeah.
want us to do it.
We'll give them a full training.
Perfect. Thank you, Madam Chair.
Thank you. Any further discussion on this item? Roll call, please.
Powell,
Yes.
Gershenson,
Yes.
Nelson,
Yes.
Todd,
Yes.
Loops.
Yes.
Motion carried.
Thank you.
Thank you. Do you want to share with us the new information on your website?
Is it possible can I sign in here? Is the IP address the same? Okay.
So we'd like to give you just a little bit of an update. We had talked in the past about emergency contraceptives, having information available. So I sort of put it out to you that we were working on a women's health page. Leanne, it hasn't been published yet. We can publish it probably today. And I'm also taking you up on your words that it doesn't have to be pretty, it just has to be easily found information, because that's what this, we hope you agree, is. And we have a fact sheet, emergency contraceptive fact sheet that's been developed, so I thought if you can look at that. Leanne's
Thank
pulling
you.
it up. Oh, I sure do. Well, maybe I will.
Yep. Perfect. Sounds good.
One more?
No, I'm good, I just had some calls, so I want to forward. Yeah.
Is that working?
I was just waiting for it.
Yep, there we go.
We're there.
Oh, it's not touchscreen?
Yeah,
Try to
yeah,
touch
it's
it,
not- I
Leanne.
do the same thing.
So this is not what the public's seeing right now, but when we publish it,
You know what? It's not gonna let me sign in.
Commissioner Todd? Thank you.
I would like to see something here that says if these side effects persist, call your physician, because I don't want people to think that there's something, something's really going on. You might have the headache, you might be tired, you might have nausea, but if any, I think side effects are usually, I'm below the dotted, the little dots, are usually mild and do not last long. However, I think there needs to be a
Yeah, we'll
however
put
there.
that in there.
Okay.
Yeah, our
Because
standard language.
Yeah, whatever the standard language is,
Yep.
see, if these persist, see your physician.
Yep.
Or see a physician.
I'll put it right, we'll have it put right at the end of that sentence, side effects are usually mild, do not last long. No, at the end of the next sentence,
Okay.
call your physician, whatever
Yeah,
our standard.
whatever
language
your
is.
standard
Yeah.
language is, because I think, we
Yep.
don't want to get into the thing of
No, yeah, you're right.
people having difficulties.
Yep.
Okay.
It's gonna take us a while, 'cause it is-
Thank you, Madam Chair. Thank you, Madam Chair.
It takes a second because you've never logged into that one.
I know,
so,
yeah. Cause it's not gonna let me log into that page unless it's my
Gotcha,
sign
okay.
in, so.
Okay.
Computers.
Is that probably gonna be an issue for them too, right?
No, because I'm just gonna log in on our side, because I have a
Okay,
presentation on
gotcha,
the
gotcha.
Mhm.
Yeah, we just had to do it with Leanne because she's the only one with permissions on this, between the two of us, or all of us, the only one that with the.
Yeah, I tried to do it under Chris and it wouldn't do it.
Well,
so.
okay.
Here, it's coming.
Must be the weather.
Technology.
It's technology.
We can blame a lot of stuff on the weather.
That's a good
Or it's
idea.
Monday.
Right,
That
that's
could
true.
be it too. Monday and the weather.
Yeah.
It's there, it's just redirected. It will not take this long to load, it's just,
Getting it booted up. Yeah, that computer is for presentations that we have standard, and so when other people log in, because that's happened to me as well, it takes a little bit of time, you just gotta pull everything
Talk to
in.
each
Yeah.
other.
Well, if they
There we
do
go.
their presentations,
Oh, yeah, we
It's-
could always
it's
bring it up.
logging in.
will it continue to work on long again?
I just, it's logging in, so.
Oh, yeah, thank you. Yeah, we gotta start somewhere.
I guess we could go.
Changing generational curses.
Probably the minute we start
They're
doing
not gonna save everybody, but I would prefer to help some kids know for themselves. Yeah, I'm gonna keep going.
If they go ahead with their presentation, will it still continue to try to let,
Yeah, it's just need her to log in, I'm gonna see what happens here.
okay.
There you go.
Keep trying to touch the screen. Oh, there it is. Okay.
Women's health, there's something for people to.
Yeah,
So it'll be, I think, where did you want us at? On the rotator or just?
they're gonna,
Info.
that top
Yep.
part at the top,
Yep.
gonna put something there. So, these are the categories that we have loaded in there. We, cancer screenings, family planning, and contraceptive services. Under contraceptive services is, it drops down into emergency contraceptives. It's all of, the free or low-cost services that people might be looking for in those categories. But then, we didn't wanna stop there, so we also have things like, I know that human trafficking and what's that under?
Injury violence.
It
Yep,
should
there it
be
is.
there.
Mhm.
Yeah, hey, yeah, human trafficking domestic violence, and that kind of information.
Commissioner Todd?
Do you have a domestic violence hotline number on there?
I think so, yeah.
Okay, good.
Yeah, Haven,
Good.
the 24-hour crisis and support number.
Leanne, can you click on human trafficking?
This one here?
Yeah, that's,
I think it's,
Because
There it
there's
is.
two places, in Oakland County, I just wanna see if they're,
I'd like to see the hotline in big letters next to human trafficking.
yeah, there's two facilities, one in Pontiac.
it is on the main page too.
Okay. All right,
If
great,
you go back, the number is right there.
perfect.
If you drop down.
Commissioner Gershenson?
And
Right
there's two facilities, two homes in Oakland County that I know about, that are, offering counseling to, sex trafficked victims.
Okay, we can get that.
One's in Pontiac and one's in Farmington. I'm blanking on the names right now, but
The problem is if you call one of these numbers, they know those resources. We don't want people to go straight to some resources and then we've missed a greater opportunity to get law enforcement involved and, from the first minute of conversation. So this was agreed upon with the task force as the go-to numbers. So that's why we put it there like that.
yeah, no, if you ran it by them, that's great,
I mean, we participate on the task force, yeah.
great. Well, this
There is a lot of more communication that has to take place in that regard, because across the county, I think there's a lot of different numbers out there, and we need to go to work as a task force of really making sure that we have a standardized communication protocol that we've distributed to all our partners, and that's what we put out there. That's why we didn't go any further than this, but we can always change it.
So this is gonna go live today?
Yeah.
yes.
Fantastic, so can we send out an email to all the commissioners to check it out?
Yeah, and then give us our feedback, just because we've gone live, we're, happy to keep tweaking it like we do all of our website.
So you just go to, okgov.com,
Yeah,
health,
yeah. And so when we publish it, sometimes it takes it a while to actually be live,
Yep.
right?
So it will be live
So-
today, but,
So try the end of the day or
Yep.
tomorrow morning,
okay,
and if it's not obvious to you, then we wanna hear that.
yeah.
Commissioner Powell?
Is there any way, when you all launch it, y'all send us a link or something to share that we're launching it so that we
Sure.
all, from social media to us, and we all blast it as well?
The thing of it is I really don't wanna give you the link just directly to the Women's Health page, because I wanna know if you struggle to find it. Do you know what I'm saying? I'd just rather you link to our general okgov.com/health page. Do you know what I'm saying?
Yeah, I get that, but at the same time, shouldn't we just at least announce it? That it's up, we can say that. I don't know, even if y'all don't wanna give us a link,
But
just
no,
to
we'll
make
give
an
you the link
announcement.
to the general page and
Right.
say, look for our new Women's Health page at
Right.
okgov.com/health.
Yeah, just even, that's fine too. I just
Yeah.
wanna see, and then that way it's kinda meeting both of what we
But
trying
let's
to
not
figure
push it
out.
out into social media till everybody's decided that
Right.
we don't have some issues that
Okay,
you would like taken care of.
okay, cool. Thank you.
Thank you.
Thank you. Is there any other discussion? Commissioner Gershenson?
Can I get this electronically?
Yeah.
So I can,
Yeah, we'll make the
feedback on this
tweak
as
that
well.
Commissioner Todd would like, and then we will
Okay.
send it, how about we send that at the same time?
that's great.
yeah, it will be linked right here as well, just so you know, the PDF. It's just not there yet because
Sure.
we just uploaded it this morning, and again, it does take some time for that to
Then
link,
all
so.
the people that have contacted me with Title X concerns, and
Yeah,
I can forward this once
Yep.
it's ready to go.
sure.
Will do.
Any other discussion? Thank you very much.
You're welcome. Thank you.
Okay.
Thank you.
Our next item is a presentation by Honor Health.
Sign out.
Just want me to sign out? Okay, there we go.
Thank you.
It's like all I see.
Thank you.
Yeah, no, I have one like that as well.
I'm just gonna look over towards your computer if you don't mind. So, good morning, everybody. We're gonna go ahead and get started while we bring up the presentation. Thank you very much for inviting us in. My name is Debbie Brinson. I'm with Honor Community Health Center, which is an FQHC. And I've asked Scott Stewart, our contract and community specialist or manager, to join us as well. Scott keeps me on track, so generally when I get back from a presentation, he has given me my written orders of you forgot to do this and you forgot to do that. So now I just say, Scott, just join me, please. So you may see Scott interject and say, okay, Deb, let's check this. So I do want to thank you very much for inviting me in, and grateful to have this opportunity to provide you more information about Honor Community Health. I hope within the next month or two we can get you in to visit a site. It gives you a very different picture than what I'm probably going to do. It'll just kind of drill down, but this will give you an overview of who we are and what we're doing. We are a young organization. We've only been around for 6 years since early 2012, late 2011. As you can see, our mission statement here that we're talking about is that really the bottom line is that we want to make sure that every individual in this community has access to quality healthcare services, regardless of their ability to pay or not. What that means is we're going to see anybody that walks through the door in providing that. What is also unique about it is that we're comprehensive in the services that we provide. And I'm going to talk a little bit about some of our unique partnerships and relationships and how we got started. But the bottom line is that we'll serve anybody that walks through the door, regardless of their ability to pay, regardless of their need for services. We are a nonprofit comprehensive center that provides integrated care, and what that means is that we do not only primary care services, but we also do behavioral health services, dental services, throughout 16 locations. So I had to go to Scott this morning and say, wait a minute, 16 locations? When did that happen? And where was I when that happened? And he reminded me that we just received a grant through the state to expand out mental health services to 4 new school-based health centers. We'll talk to you a little bit about that as well. We are an FQHC, and that is really, really important for you to understand. So you're going to hear throughout this presentation and through other places FQHC and CHC. FQHC is Federally Qualified Health Center. It is a unique designation that is given to only specific communities throughout the nation or within Michigan. And in Oakland County, Honor Community Health has been given that designation. And why that's important is that it gives us access to unique financing opportunities that most other communities don't get. And what makes that unique, I'll talk to you a little bit about here. We are governed by a board of directors. So we have a 11-member board of directors, of which 51% have to be consumers. And when we drop below that 51%, we lose our funding for whatever period it takes for us to make sure that we hit the 51%. So we'll talk about that here in a little bit. We were created through community partnerships, and that very first partnership started with OCHA, or Community Mental Health, back in 2012. Community mental health really saw a huge need for servicing its patients, its clientele in primary care that wasn't being met in all of Oakland County for primary care, that many of their patients were ending up in the emergency room. I don't know that I've shared this with you before, but my mother receives mental, or had been receiving mental health services through CMH. My brother received services through CMH. And the only time I ever knew up in Lansing or in Saginaw what was going on with them is when I would get a call from the emergency room that says, you need to come down here and get your mom or your brother because we cannot release them for services. What we do know is individuals who have serious and persistent mental health issues are 20 years, die on average 25 years sooner than most other individuals, which is very true that got played out with my mom's situation. CNH or CMH or OCHA now, at that time, awarded us a $4 million grant over an extended period of time. Probably some of you know that it was extremely rocky start for the first couple of years, although things have smoothed out dramatically. And you'll see here in a little bit about how that ratio of funding from community mental health has gone down steadily over the last 6 years, which means it's been a wise investment and it's done exactly what they need and this community needs us to do. Give you a quick synopsis. We have started with 24 staff, of which many of them came over through the old hospital, old Pontiac General or Doctors Hospital. We picked them up under primary care. We now have 125 employees working for us. We have 11 sites, soon to be 16. You heard about my 4 school-based health centers, but we have 1 mobile unit, we have 1 dental, 4 school-based health centers, and 6 primary care sites. So, do you remember when I said FQHC? Federally Qualified Health Center. And do you remember when I said community, CHC, Community Health Center? Those are very, very important definitions. They only come through an award through HRSA, through the federal government, through a very competitive process. The our board of directors, as well as I, really do see that designation as a designation to the community. We cannot shut down sites because we want to shut down sites. We have to get approval from the feds to shut down the site. The feds see that designation to that community. So that community, in this case, is Oakland County, Pontiac, Southfield, Waterfield in particular. It means we serve every single person in Oakland County that makes a decision to apply for services. It's important for you to know that the Board of Directors, we've been asked to go in and serve within Livingston County and within Wayne County, and the Board of Commissioners, or our Board of Directors have said no, that they will only stay focused on servicing the residents of Oakland County. This designation allows us 2 very distinct things, an FQHC and the CHC, so that you understand that. Once you get that, it allows you to start applying for or receiving reimbursement through Medicaid at a higher rate than others that do that, with the agreement that when you get that higher rate in and servicing the Medicaid population, that rate will be used to serve uninsured individuals. And I'll talk to you a little bit about what those rates are. That's very important. That's the reason why you do not have general practice people seeing a large number of Medicaid patients. They lose money. They never receive the amount of money needed in servicing the population. So if you were to go through and see, it would be very rare that you would see a private provider only seeing Medicaid because they lose money. It's even more complex and difficult when you have providers who are seeing both CMH patients and the Medicaid population at the same time because they have very complex issues. So think about it. So I'm going to use my mom as a great example who has schizophrenia, would go in when she's not using her medications. This is a college-educated individual. Go in not using her medications, go in, and she would be assured that that person in the emergency room or the provider through CMH was out to get her, was out conspiring to get her. The voices in her head would assure her doing that. So now I'm in, she's being seen at McLaren in the emergency room. So now as a provider, not only am I dealing with taking care of her needs every single day, but I'm also having to deal with the voices in her head. So she may be saying, I'm not taking my meds because they've been stolen and they're out to get me, or they've been poisoned. So now my 10-minute visit now is a 45-minute visit. Why it's important you have to take those meds for your hypertension pieces. Why you have to be someplace safe and not out prostituting on the streets. So you can imagine now why our centers become really an important point of care for individuals. There are some really the other piece of that is that enhanced reimbursement that I just talked about, but the other real unique thing is you never not want to become an FQHC. You can kind of what they call a look-alike, which means we'll give you some things, some benefits for servicing the Medicaid population, but we won't give you the full benefit until you're an FQHC. The other one is it allows you to apply for only grants that only FQHCs can apply for. So a good example of that is we recently received money to hire another mental health person to work within our clinics. We received money about 6 months ago because of good quality measures that we're getting. That means we as an FQHC get that and nobody else gets it, recognizing that we're servicing very complex patients and that our ability for suing is much higher for those populations than the general population. So what you should know as an FQHC is we have to be nonprofit, we have to do comprehensive services, we have to be in a high-need community area, what they call a medically underserved area, and or underserved population, both of which we are, and you have to be governed with a community involvement. 51% of our users must be users, which means they are my boss. They hire and fire me. They do my annual review, and they do it brutally honestly, which is what I appreciate. And we have to see and treat patients regardless of their ability to pay. So the next two slides I'm going to jump over. They're for you. So if you ever want to know anything about what's happening nationally around FQHCs, here's a little bit of information for you. Michigan, we're part of a larger network through the Michigan Primary Care Association. So there's information there for you. But let's go to Oakland. Since you're Oakland County Commissioners, you probably want to know what's going on in Oakland County. We are the largest FQHC in Oakland County, servicing over 30,000 unduplicated patients since inception. We've been designated as both as an FQHC and community health center, but we also have a special designation servicing the homeless population. So we hire a case manager that works with all of the homeless shelters in doing care coordination for our homeless population. I like to use this example because it's a really good example of somebody who's homeless and somebody who has mental health issues. The homeless population, for the most part, know where to go for care. So one day we get this knock on the window on one of our outdoor windows just like this. And somebody walks over and says, "Can I help you?" And she's like, "I got mice in my belly." And we've seen her, we know that she's homeless. And we say, "Okay, come on in, come see one of our physicians." We bring her in, and lo and behold, she's pregnant. So of course she has mice in her belly. She doesn't know that she's pregnant. She's got some serious mental health issues. But now I have somebody who's pregnant who needs that care. So we bring her in, we get her integrated into the practice. We know she's going to be high-risk pregnancy piece. We know because of the voices in her head. She thinks she has mice. Now we have to help her understand what's happening. So our care coordinator, our homeless coordinator, is now working with that mom and getting her in for high-need, high prenatal care elsewhere. This Board of Commissioners, through the original vision of community mental health, is very committed to servicing patients through our partnerships with our other providers. We do not have a building of our own, which is a good thing and a bad thing. So we are committed to servicing through Easter Seals. We're committed through CNS. We're committed through OFS. We're committed through the schools. We have a very strong relationship with Children's Village that I'll talk to you a little bit about. So we believe, and our board of directors believes in going where patients are and partnering within the community to deliver those services. And that is in keeping with the original intent through CMH. So let me tell you a little bit about Honor really quick. Primary care services, I've talked to you about them. You'll see the 6 there. You'll see all of them are in different places. Our dental center is Joslin Dental Center, as well as we now have a mobile unit, which we will be kicking off through next week through a ribbon cutting, or I should say floss cutting ceremony. But we also have school-based health centers. And one of the things that happened when I first started here was George Miller was on the original board of directors and the original group that came together. And he came to me and he said, Deb, I really need you to come and deliver services out at Children's Village. And I'm like, Children's Village? What are you talking about? So he takes me out for a visit, and we are not a full FQHC, so it really does not make sense for us to deliver services through Children's Village. Until he takes me on the tour and we discover there's a school at Children's Village. Oh, we could apply for school-based health center funding. Okay, let's apply for school-based health center funding. And so for the first time ever, the state funded its first school-based health center as part of a children's network of services through Children's Village piece. And so we're very excited about that. We have a full-time provider out there delivering services. So this really starts to get to the heart of what we've done really quickly. You can see in 2012, we started out with 4,000 patients. At the end of 2018, we're over 30,000 unduplicated patients that we've touched throughout the network of services. You will see not only are we seeing patients, but we're seeing how many visits. Again, started out with 8,000 visits. We're now at 189,000 visits. We're averaging about 4 visits per person coming in. That's great. That means that we are not doing acute care. It means that we're servicing as a medical home. We're touching base with that person. That's what I want. We want to know what's happening with that individual. So this really starts to get, and Kathy and I just said we probably should do the same for the health department because of our strong partnership. We, through community mental health, overlapped our patients to say how many patients are we servicing through CMH and through OWIN? Are we still staying true to the intent? So what you'll see is 45% of our patients are also OCHN patients as well. Now, the payer mix becomes really important, and someday you'll probably want me to come in and explain this more because this is where all of healthcare is going to change over the next 10 years, or probably over the next 5 years. Payer mix tells us how something is getting paid and who's paying for that. So what you'll see here is our payer mix is 56% of our patients are on Medicaid. Remember, I want to serve Medicaid patients. I get an enhanced rate for servicing Medicaid patients. Federal government says you cannot ever not see them, Deb, so we're going to give you additional dollars. It's kind of like special education in schools. Schools get paid an enhanced rate for special ed dollars so that they provide those support services and ancillary services for kids. So 56% are Medicaid, 16%, and this is really important for you to understand, is Medicare, which means individuals 55% higher, 55 and older, are coming in. The traditional amount that I'm used to seeing is 5 to 8%. So here in Oakland County, it's double. That's important for my board of directors to know as we're planning services out. And for anybody in the CMH world means that that population 55 and older will probably be expanding out. That's something for us to be taking a look at. 14% are private insurance, and then 14% is also non-insured. That rate is starting to change, and you should be aware of that as commissioners in this community, because when my Medicare rate is dropping, or Medicaid rate is dropping, 2 things are happening. It's either moving to Medicare because they're becoming 55 and older, or they're picking up with no insurance. And what we're seeing is the higher no insurance rate starting to go up. That means for us and for other healthcare providers, they're not getting reimbursement. Now, hospitals are going to be concerned about that because they're used to the dish payment. So the old financing days, they would get a dish payment to offset their loss in servicing the uninsured. That no longer is at the table. So that's the reason why you see a lot like St. Joe's is expanding out and trying to do more primary care to hit that Medicare population piece of that. You'll see more rural hospitals. It's a huge issue with rural hospitals combining and coming together. So this is something, if I were you, that I would periodically ask to see what's happening. We're seeing this at the local level. Moving to work requirements, I'm scared to death of work requirements from a healthcare perspective, because most likely the language in there is so tight that if you miss out on that you're going to move to the uninsured, and you're uninsured for a year at least before you can become qualified for Medicaid. For me, that's huge. So I'm expecting that my Medicaid number is going to actually drop and my uninsured is going to increase. The next slide is our revenue sources, and I think this speaks to the stability that we've come to, the rocky road that Commissioner Taub and others know firsthand. Commissioner Powell probably also recalls, is that when we started out, it was extremely rocky. We weren't sure. When I first got there, I actually said to our board, you need to shut us down. There's no way we can survive here on this. We're not generating enough money on this. The problem is you got 10,000 Medicaid patients here with no place to go. So I am grateful to our partnership with Community Mental Health, who stabilized us, as well as our partnership with McLaren, who allowed us to take the money that Community Mental Health and run it through the DISH payment mechanism the first year. That bought us 2 more years till we become an FQHC. So 15 through 18, you can see a couple things are happening here. One, our fees are increasing. That's what you want us to happen, is those fees increase. And 2, we're picking up additional HRSA grants. Now remember, only those HRSA grants go to an FQHC, which means it goes back into the community. And that's important for you to know. That's the reason why we feel we're stewards of this designation. It is not Owens or Honors designation. It is a community designation piece on that.
Commissioner Gershenson?
Can I just get
Sure.
clarification, because you've got OCCMHA, and then in 17 you've got OCHN. I'm just a little confused
It's-
about the community mental health agencies that you're,
So it's one, they changed their name.
right, so this is the same
Right,
organization.
right.
And when you refer to community mental health, are you referring to this group?
Yes, yes.
Okay,
Yep, we only work with one community mental health.
okay.
And that's because there's just too many acronyms and I just lose track. So it's CMH to
Right.
me forever.
I'm with you, I hear it, so I just wanted to clarify. I was
Thank
getting
you.
confused, okay,
Yeah.
thank you.
Yep. So that's important. I don't see these numbers changing. I still see us, this actual program income will probably drop if the work requirements goes into effect. And what you'll see is the level of uncompensated care go up. So for us as a board, our board of directors are coming together to strategically plan. That's something that we need to take into consideration. So I'm going to move quickly on to programs and services. You know we do primary care services. We know we do dental, both restorative and dental services, dentures as well. We do behavioral health, and that is short-term behavioral health. We do not do long-term behavioral health. We rely on our CMH partners to carry out the long-term mental health. But we do short-term behavioral health services. Psychiatry, it is the #1 issue in terms of getting in for meds, particularly for individuals who are mild to moderate and who may not be on CMH dollars or into long-term. We often, primary care docs, get asked to continue their medications for those services. Obstetrics, OB services, this is probably how I got to the table, is on women's health services. So we have a very robust OB service that we have. I'll talk a little bit about that. Care before, during, and after services, case coordination for pregnant moms and families. Because a lot of our women are coming in late into trimester or have multiple health issues, we'll do referrals going out.
Commissioner Tom? Thank you.
Okay. Specialty care services, we do HIV services. We have a very robust HIV program, Hep C program here, and our PrEP program, as well as our PEP program, as well as nutrition services. So let me get you to OB services. Last year, in 2018, we did 184 pregnant women that we served. We saw 71%, that is our goal, is to get them into first trimester. We know that birth outcomes are much better when they come into first trimester. Of that 184, we did 98 deliveries. So about a third of our deliveries get referred out to St. Joe's because of high risk. And that is a good thing. We want them going in for high risk deliveries. The great thing is that our birth rates are really good birth rates. We've worked really hard over the last 5 years to drop below the state average in terms of having very low birth rates. So we're having babies that are being delivered with a high birth rate, and that's a good health outcome. Success of our care coordination, third year in, we realize that these women do better when there's another woman there supporting them and encouraging them to come in. We all know, I'm a mom of 3 kids and life gets pretty darn busy. And if everything's going good, I might skip an appointment to take care of the other children. So we had an OB coordinator working with those women to make sure that they were coming in for OB services and getting them where we needed to be. 90% of our patients delivered with high birth rate. That is great news. Women's health, we are now moving to Title X pilot. I can answer questions about that here in a little bit. FQHCs generally don't do Title X. My background is women's health services. I'm extremely committed to women making sure that they have access to contraceptive services. That a strength of a community is when women can do planned pregnancies coming in. What we noticed is that one of the docs came to us when I first got here and said, I cannot do Title X I cannot do birth control services to patients, and I'm sitting on several devices. Is there a way we can help? And so we began discussing making referrals over to Honor for services. We are now in a pilot project with the state to look at being the first FQHC non-public model. Ingham County is doing it, but they're a health department FQHC. One of the only 2 in the state of Michigan. They probably wish they hadn't done that. In retrospect, there's no wishing. They've been very clear with me on that. They would not do it again because it's so complex. We are now in our second year of piloting the Title X, which would mean that we meet the requirements of becoming a Title X provider. And we're also then aggressively pursuing teen pregnancy prevention dollars for services in Oakland County, particular Pontiac, working with the schools.
Just one.
Yep, see, I told
Just
you.
one thing real quick is that we also just received a grant from MPCA, which is our state association, and the state of Michigan as well for maternal dental services. So having a specific hygienist focused on providing that dental care to pregnant mothers, noting lots of data that has come out on the importance of addressing that.
Right. So there's strong correlation now between SIDS and oral health amongst pregnant women, and so this will allow us to continue with that. After 5 years, here's our health care indicators. We have to report out aggressively. This gets published out to HRSA in terms of what the indicators are. So every February and March, you'll see us buried in collecting data and looking at that data. This 18 will come out next month. We'll be glad to share it through Kathy. But these are the healthcare quality indicators. As you can see, we're right where state average is, which is good. Our board is pushing us to start to exceed, which is a good thing as well. The first partner that I came to when I came into my job here was the health department. So I don't think I was even here a week. Besides meeting with CMH, the next person that was on my list at that time was Kathy and George Miller. And so I put a call and said, listen, to be an FQHC, we cannot do this without our health care partner, our health department partner. You see data in ways that we can't see data. You can message things in ways that we cannot message. And really the core partners, in my opinion, in a community should be the hospitals, CMHs, the health departments, and FQHC. Each of us brings a unique feature to the table that creates a continuum of care in a healthy community. And since that inception, the first thing that George said was, you gotta help me out with Children's Village. So we have a grant. We've been working now extensively with Children's Village for the last 5 years, delivering healthcare services to all of the children coming in to Children's Village, but also then making sure that they receive care outside of Children's Village when they leave the village, which we all know they will and should, and that should be the expectation. But the big piece that I'm looking to the health departments is social determinants. One piece of good health care is access to primary care and prevention services, but it is also understanding the unique issues that social determinants bring into health. And that is not necessarily our area of expertise. So I'm always looking to Kathy and her team, Luann to her team, for guidance on how do we bring those services to the table. Public health interventions are unique. They're very different than primary care services. And so that's really very, very important. I would say our number one or our second referral provider is the health department through the 800 numbers. We get a large number of HIV patients coming in, large number of women coming in for pregnancy-related services or primary care services. Without them, we'd be sorely, sorely missed. So I think this is a great collaborative partner. I can't speak highly enough about this health department. And I've done enough work with the health departments to say this is probably one of my favorite ones to work with. Collaboration, you've heard us talk about CNS, Easter Seals, OFS, Pontiac schools. We're now reaching out and we'll be into Avondale, Ferndale, and Farmington. And
Waterford Mason.
And Waterford Mason as well. So I think that gets to the core. You're probably asking, how can I help? There's a couple things that you could do. One is make referrals. So when you get constituents, feel free to have them call us anytime. We want to see your constituents, anybody. Even if we don't end up being a good resource in healthcare, we know how to hook them up. Come take a tour. I think Commissioner Taub was sharing that she'd visited one. They're very different than what people think about. So we're setting up one of those as well. I'm always looking for board members. So if you know of anybody that's interested, please let us know. And I'm going to let Scott briefly talk about the floss cutting of the mobile unit piece. And you have a flyer in there.
A couple years back, we received a grant of $500,000 actually from Delta Dental Foundation. And that was to implement what we call the Healthy Smiles mobile unit. So basically a dental office on wheels. It has 3 dental chairs. And so we have a hygienist who goes around basically and provides dental services to alongside different community partners in the community. So places like Baldwin Center, Hope Shelter. We actually go up to Holly Schools and a bunch of other different community partners. We basically, as Deb mentioned, we follow the model of going where people are. And so that is what we also do with this unit, is we go where people are, we partner with community partners and continue to provide dental services that way. And so we started that in December, but now we wanted to have a formal, as we have worked out the kinks of the unit. Of course, it's always a very different model. So now we are working with Delta Dental to have a floss cutting, basically a ribbon cutting, on August 7th from 1:30 to 3 p.m., and that will be at the Baldwin Center. And so if you all would like to come, please feel free. I'll send out a formal invitation that I can send to your emails as well later today.
Thank you. Commissioner Powell, and then Commissioner Todd.
Couple questions. So if a person doesn't have a person has insurance but unknowledgeable about it, is there a system that you all can access
Yeah.
to find that out? Okay, that's
Yep, so
number
it's
one.
called CHAMPS.
Okay, got that.
Yep.
Okay, Avondale School, is it the high school or is
Yeah.
is it the actual high school or the academy?
The actual high school.
Okay, and then do you all partner with the first time mothers and all of that? Do you all partner with the Oakland County Health Division Nurses Program?
We do.
Oh, because it's phenomenal. I was one of those products 15 years ago, and that's the bomb program
Good.
for first time
Good.
mothers. So I was going to say, no, we need that connection to Afton.
Absolutely.
Yes,
We refer to them for the OB services, and they refer back to us. For
Like
any
it.
OB services that they're providing that we don't have to our NFP program, so it's a phenomenal.
I mean, I think a dream of mine is that we have a women's center, and
Oh.
all of those are all co-located, all together and working
Okay.
together. Ingham has a very similar program, and this has worked out great, but I have to go online with my women's health and OB service program.
Thank you.
Just makes it even that tighter.
Yeah, that's good. And then you had made a comment, you were saying that I wanted to know, why is it good to be high-risk pregnancy? Like, why is it,
Well,
why is it good?
It's not good to be high-risk pregnancy. What I was saying
Oh,
was,
okay. Clear that
it's
up. I
good
just-
to,
I was like, why
it's
is it-
good to make the referral for the high-risk pregnancy
Oh.
piece, because generally, women who are in that category don't get into services, and we have a unique relationship with St. Joe's
Got it,
on
okay.
taking that. So thanks for the clarity. I would not want to be construed with that one. I'd be-
Okay, and then one thing too, Scott, can y'all just send us a, I guess if y'all have more of a flyer that kind of details what you all do
Yeah,
in combination with us, so we can send the locations.
you bet.
You know what I mean? Just
Yeah,
so when we
absolutely.
share it, because I'm the
You
social
bet.
media girl, so when I share it, they'll know, oh, if I'm impacted with this, this is a center I can go to, or
Yeah.
call that number.
Yep.
I'll
Okay,
send it
thank
later
you.
today, Angie.
Okay, thank you.
Thank you. Commissioner Todd?
Thank you. Thank you, Madam Chair. I think that's not on, but it doesn't.
I think it's on.
Is it on? Okay.
I think so.
I have a few questions, if I may.
Yep.
Are you getting Ryan White funding for HIV?
Yes, we are.
That's terrific. So you
Yeah.
are, is the center, around, down the road here, is that the only Ryan White Center?
So we do our Ryan Wright services through Summit, which is CNS, over at CNS. But we'll see, we try to keep it focused in one area because of the complexities of all the labs and the support services. But if we need to, we'll coordinate that care with another location.
And just to also, because I helped kind of run that program for a while, we get the outpatient and ambulatory care health services through Ryan White, but we do partner with the individuals getting like preventative care and case coordination pieces, and so we partner with Matrix and OLSA, and we actually co-locate their services as well in our location when we provide our HIV services.
Good, because there is an uptick.
Absolutely.
We know that. And-
Yes.
And I think it's important to get to this newer
Absolutely.
generation. I have a couple more if I may. Your Medicaid patients, are you receiving fee-for-service or are you capitated?
So that's the difference. It's both. So as an FQHC, we bill. We don't get a capitated rate. We bill the health plans for whatever rate that's been established on that. And then what happens, Commissioner, at the end of the year, we settle with Medicaid in terms of what they owe us for the enhanced reimbursement for Medicaid. And that is a challenge for anybody. Hospitals go through the same thing, and we're in that same boat.
So if you have people who come in without any insurance, do you help them find what they need?
Absolutely.
Okay.
Yeah.
My other question is this, as you know, there is now a difference in funding for mental health. People who have Healthy Michigan are not also capitated, so mental health funding
Yeah.
has gone down.
Yeah.
What do you see in the future for this?
I think everything's going to move to value-based payment, and I think you're going to see probably, in my opinion, you're going to see a hybrid of what they've been proposing, which is to integrate it all into the health plans. I don't think that'll happen. I think what will happen is they'll move to a value-based payment, and I think you're going to start to see those ideas start to merge out in the next 2 years. There will be some level of change, but what I've said to everybody since day one, first of all, you can't close down CMHs. They're in federal statute. Feds are not going to close down CMHs. But will the financing from state dollars change? Yes. I don't think it'll go away completely. And I think, and I've thought this since day one, you should carve out the DD population and allow them to go through CMH and allow them to go through the providers. You cannot. As a parent of a special needs kid for many since birth and who's now 30 and still deals with it, it takes certain provider types to work. And I know initially Owen was set up to be one of those, but really we can't be set up. The complexity of the patients that are served through the DD network really require that level of complexity and parent support. And I don't think that should go through the health plans. It'll never get fully met. So I think with the changes that'll start to occur with the new Medicaid director, with the new person in Medicaid, you'll probably see a level of hybrid. I don't think you'll see the complete conversion over. And I think there'll still be lots of room for discussion from you all, from CMH, from the health plans as well.
Because people who, if I may, Madam Chair, people who are getting Healthy Michigan, who also qualify for Medicaid, CMH is not getting the dollars for
Yeah.
them. But they still have to take care of them.
Yeah.
So this is the complicated issue, the unintended consequences, I believe, of Healthy Michigan.
So I know that there will be a reorg plan submitted out from the department probably within the next month, if not within the next couple of weeks. And I would encourage everybody to take a look at that, because that really is going to be the governor's direction for what she sees happening. If it were me looking at it and I see mental health being converted under Medicaid, says to me, okay, it's some level of something's going to be happening, because you're not going to move mental health over to Medicaid if there isn't some level of intention of crossover. So I think those are the kinds of things, Commissioner, that I would be looking at from there.
Thank you, Madam Chair.
Commissioner Gershenson?
Well, thank you for that enlightening presentation, and thank you for sharing so much of your own personal history. It really, it really presents such a meaningful, emotional package that you offer as leading this organization. And also, I'm so proud of our health department and their
Yeah.
willingness to
Yes.
share, and their willingness to have you come in a
Yes.
few times
Yes.
to deal with so many of the changes that are happening in our country. Specifically, you're trying to become a Title X.
Right. So because of all the changes, so I have run Title X, and it's extremely complex program. And for an FQHC, it's even more complex because you have to designate out your dollars separately and be able to track those out separately, pieces. But I'm confident that we'll be able to become a Title X, and then we'll work with Planned Parenthood here in Oakland County if they continue to do Planned Parenthood or continue to do Title X services. I will always do women's health services. But I think for them, much like community mental health, funding flux at the federal level is still to be determined in how it gets rolled out at the state. Michigan has appealed all federal changes on it, so it'll get tied up for a while, but the question is how will they proceed?
And if a young woman comes in and she says, I'd like an abortion, what happens?
So right now, we can give her what we call options counseling by anybody that's doing Title X. That will change under the new federal laws. It won't change that she won't or her partner won't be able to get information on abortion services. It changes who can deliver the information. So the provider, the physician or the nurse practitioner will be the only one that can talk about abortion services, where right now a nurse or a social worker can give those what we call options counseling pieces.
So even if the new changes to Title X are implemented, there will be someone at Honor Health that if that young woman comes in and says, I want an abortion, can talk to her about it?
Yes, yes.
Okay. Where do you deliver babies?
St. Joe's is the only one here in Oakland County that does OB services now.
Okay.
So we do our deliveries at St. Joe's.
And when, looking for board members, when does your board meet and how often?
So our board meets monthly. They have to meet monthly, regardless. And then we have two subcommittees, our finance committee and our operations. So a board member has to commit to serving on the board and then serving on one committee.
And what time are your board meetings?
Our board meetings are Wednesday. That might change, but right now it's Wednesday, the fourth Wednesday of the month from 4 to 6.
And then your committees?
Our committees are whatever's best for everybody.
And they normally meet once a month?
Normally once a month generally by phone.
Oh.
Yep. By
That's
phone.
helpful.
Yep.
Do you need more dentists?
Yes, we're always looking for dentists.
Okay,
So
so
if
if
you
you
know
could
somebody.
send me that information
Sure.
that I could forward on to dentists.
Yep.
really excited about working together, and personally am also very interested in your pipe dream of a women's health center.
Okay.
So I'd like you to keep us in the loop on that, so that perhaps there's a possibility for some partnership.
Perfect. We'd love to do that.
Thank you.
Commissioner Nelson?
Thank you, Madam Chair. And first, again, thank you for
Sure.
coming and presenting in regards to Honor Community Health. I think in order to have healthy communities, we have to have healthy people. So
Yeah.
thank you. As a behavioral health provider myself here in Oakland County, I understand and value the importance of comprehensive services. With that being said, can you give some examples of your behavioral health services that are? Ooh,
Yeah.
Thank you. Can you give some examples of your behavioral health services that you presently, and I know that you made a distinction of short-term versus long-term, so what short-term?
So
behavioral
short.
health
So I'll give you a really good example. So I was walking through on Friday, and there was a patient crying, and so our behavioral health person was in there, and she asked me to just step in. Chronic, a CMH patient that was coming in, and she was complaining of back pain. Now, this had been her third time in. We pretty much know, or the physician felt pretty comfortable that this was medication seeking. And so the behavioral health therapist was working with her to come up with strategies on how to handle the pain. And then a short-term plan of going over for St. Joe's for an MRI, just to make sure to rule out. But the sister was in, sister abandoned her there and just said she's just making this up. So the behavioral health person worked with the sister to get her to calm down so that she could take the patient over to St. Joe's to roll it out. So when I'm talking behavioral health, I'm really kind of talking those situational pieces. It's more about coping mechanisms with the moment pieces. I have no problem sharing about my life. So I'll give you another example of, and this mirrors it, but from a personal standpoint, we work with a lot of families, and my daughter, who I told you had special needs, kidney disease, and is going through some severe depression. She also has a behavioral health person in her practice, in primary care practice at U of M. And so situationally, it will be, okay, Katie, what's the strategy for how do you manage the stress between now and our next visit? So it's that short term. It's not the psychosocial. It's not the medication reviews in terms of long term. What do we need to be on to help you strategize? It's the social determinants. I know you don't have a place to live. Okay, let's talk about what's the next steps. Really kind of mobilizing beyond that anxiety and depression to helping survive to the next appointment, to the next piece of that.
Thank you. Last question?
Yep.
Do you have currently any board certified behavior analysts
We
on
do
staff?
not.
You do not. Is there any future?
It'll be interesting because I am working on a state project. We just got state project approval for caring for students. So next week there will be a Medicaid bulletin coming out. So I do policy work as well that will first time recognize that and get reimbursement. So when you see that bulletin come out, you are going to want to send comments to Medicaid on that.
Absolutely. I'm a board certified behavior analyst.
Are you? So you'll be excited about this
very
because it's getting added to the list. So there will be a number of things coming out, and I think the bulletin will be released this week. If not, they're waiting for final approval from CMS on the expanded Medicaid piece of that. So
Thank you so much.
Yep.
Thank you.
Thank you. All right, we need a motion to receive and file our report. Motion by Commissioner Nelson. Support by Commissioner Gershenson. All in favor, say aye. Opposed? The motion is carried.
Can I
Thank you
just
very
make-
much. There was, Commissioner
I just had
Gershenson.
one more comment. So you talk about notices being sent out. Do you receive their notices? Can we be kept up to date on some of
So
those?
they get Medicaid notices all the time. So this is a Medicaid bulletin. So periodically Kathy will send something over. You can also get on the Medicaid bulletin list. So just go to the state, type in Medicaid bulletins. It'll take you to a place where you can sign up to receive bulletins.
But what about your updates, Honor
Oh.
Health
You
updates?
should be on our list, but I'll double check.
Okay.
Sometimes,
Yep.
you know how You know how emails can go spam. and
Yep,
all that.
we'll make sure, we do a quarterly update to the board, we'll send it out. We'll send it wide and far. And then the last thing is you have my business card in there, and there's my cell phone. That's my direct cell phone. You can call me day, night, or weekend on it, anytime. Okay?
Thank you.
Thanks, you guys,
Thank you.
appreciate it.
Is there any other business to come before this committee? If not, without objection, I declare this meeting closed at 12:11. Thank you, everybody.